Good morning, Dominica. How are you doing? It is another wonderful, beautiful Saturday here in the Nature Island, Dominica, and of course, your host, Leandra Lander. Made it to the end of another week, and so we just want to welcome you to another show. We've been having some absolutely wonderful guests, and I promise you that our guests today are no different, all right? And it's a really good topic. All our topics are good, actually, you know. But we want to say thank you for joining us on our frequencies, 88.7, 93.1, 107.9 on the radio. Just saying good morning to all the constant listeners and even the new listeners of Elevate. And, of course, those of you on the Facebook page, good morning to you, too. We have a very handsome guy today and a very lovely, beautiful lady. And they'll be they have joined us and will be sharing with us some wonderful tips and just this wonderful discussion to do with diabetes. You know, it's all good that we can live our best lives, but sometimes we just have to take a little stop and pause about how do we make sure that we're living our best lives. All right, so as we get ready, we're going to take a word from our absolutely amazing sponsors. That's what I call them, because they make Elevate possible every Saturday right here on Kyrie FM. All right, so we say thank you very much. And so just stay tuned, call somebody and share the live. If you're on the Facebook page, share the live. And or if you know someone and they are a radio listener, tell them to tune into Kyrie FM right now. We're going to have a very, very good discussion as usual. All right, so stay tuned.
Sagicor General knows that home is where the heart is.
Malcolm Stephen & Sons across the bridge is the headquarters, guaranteed for all your frozen meats, poultry, ham, turkey, fish in fridge every day, every week, from Monday morning to Saturday afternoon. Malcolm Stevens is the people's first choice for the ever-fresh quality, with the widest variety and assortment of all your fresh favorite frozen foods from across the Caribbean and across the world. Guaranteed freshness. Pat mouton, pat cabouit, mandi lapo cabouit. All the frozen chicken parts you could ever need. Legs, breast, well, yes, breast, chest, thighs, feet, gizzards. Malcolm Stevens' back and neck is not back and neck, is neck and back. Dominica alone gets the freshest and the best from Malcolm Stevens & Sons. Swinging sassant for their drumsticks there and first serving it. Your beans, your peas, your salted and pickled meats, tout pat cochon. When you want a broth and a soup, you need to come to Malcolm Stevens & Sons. Nobody makes a better pillow or broth or soup than a Dominican. But the secret is that they buy all their tastiest, nutritious and satisfying frozen foods only at Malcolm Stevens & Sons in Portersville. Tell them I sent you. 448-8709 or 235-5521.
Pure, crisp refreshment. Caribe Hard Cider. Yours to enjoy. With a delicate, exotic taste you just can't get enough of. Caribe Hard Cider is perfect for any occasion. Crafted with champagne yeast, it's an all-natural, gluten-free blend that'll keep you coming back for more. Caribe Hard Cider. Available in original, pineapple, and rosé.
I find the skin of my house has a disease called pentapes. Has to do with paint. What are the symptoms? Symptom, well, it's as if somebody guaffiate and the glossary has departed from it. You have come to the right place and the right brand. Do it best quality paints. There are two types. The Master Touch for interior and exterior, Laupa Besoin PS Primer, and the Color Solution. With both of them, you can mix and match. Souvenir cooler to match anything in your house, even your soap dish. Just bring it in. Do it best quality paints. The primer for all services. Floor paint, pulaku, your garage, wall paint, ceiling paint, and for your steps, pumunpak chichile, asubobonyo, les step lamouyi. Plus every paint accessory you can think of. Just lay shell. Do it best quality paint kote. Do it center. Asu Goodwill Road. Multinadi, I call it the Paint Laboratory.
Hello?
Hey, sweet, I'm at KFC and they got a new deal. Perfect pairs for only $15. And I don't know which pair to pick. Here are the deals.
$15 perfect pears at KFC. Pick a pair of 3 pieces of chicken and 2 biscuits. $15. 5 wings barbecue all hot and a corn. $15. Or 2-piece chicken and 4 wings barbecue all hot. $15.
You got it.
Pick a pair at KFC and it's a steal of a deal for $15. Our $15 perfect pears only at KFC.
Are you looking for good eggs? I mean quality fresh eggs straight from the farm? Well, we have exactly what you're looking for, no matter the quantity. We've got the right amount. Visit us at Prince City downstairs Kyrie FM on Independence Street for your fresh farm eggs, or call telephone 448-7331, 448-7330 or 448-8752 and we'll get you your fresh farm eggs.
I'm not exaggerating, boiling with excitement.
Ooh, isn't it? Lovely, lovely things indeed. Your small enterprise of choice for personalized cups, mugs, pillows, glasses, tote bags, corsages, and so much more. Weddings and birthday keepsakes. 245-8483. Visit our Facebook and Instagram pages. Lovely things, anything but the ordinary. And we are back again. Thank you to Malcolm, Stephen and Sons. We want to say thank you to HHV Whitchurch, the agents for Caribe, KFC, Do It Center, Bell's Farm Egg, and lovely things. And of course, I must say thank you to Kyrie FM, who allows us to have this absolutely great show every Saturday. So without any further ado, if you saw the poster, even if you didn't see the poster, the poster basically says, when sugar and spice isn't so nice, exploring diabetes in young adults. And we have two, very appropriate people to speak about that. And as usual on Elevate, we ask you, what is in your cup? All right, we hope whatever is in your cup this morning is not too sweet, yeah? And it will definitely be something that will give you a boost for the day, but definitely maintaining our health. All right, so we hope it's something nice. I hope you started off with some water at least. All right, so we have here with us Dr. Lisa Jolly. Hi, good morning. How are you?
Good morning. I'm good, thanks, and you. Thank you for inviting me to speak on diabetes in the youth today, because I think it's a very important and appropriate and timely topic.
All right, and how was your week?
It was busy, but it was good. So I really can't complain.
All right, and we are also joined by Elias Dupy. Good morning, Elias. All right, we can't hear you just yet.
Good morning, Lily.
Great. So we have you now. How are you?
I am awesome this morning.
And I should say happy Sabbath.
Happy Sabbath to you too.
All right, so we have Elias. I'm going to just ask them to introduce themselves a bit, and then we'll get into our discussion of diabetes. And just to say, Elias, a lot of people who probably didn't necessarily know this, so happy to see you attached to this. And you've offered yourself to talk about it. You know, it's not often that men especially talk about their health issues, you know. So, Doc, tell us about your profession and how you came to, I guess, choose diabetes as your career. Your career, yes.
Yeah, so my name is Dr. Jolly. I'm a general practitioner. I did my undergraduate training at the University of the West Indies, and my chosen areas, my primary specialty is actually in general practice or primary care.
Okay.
And so that's where I started off, and I had a private practice. And one of the things that I realized is that that many people who came in, even for a routine visit, had elevated blood sugar of 200 and also an elevated blood pressure, sometimes over 200 as well.
You know, while you'll tell us about those numbers, what are the right numbers? Yes.
Yes. And so I realized there was a gap in care in terms of, in terms of diabetes prevention, but also diabetes management. And I was looking for additional training or education in diabetes when I stumbled upon a fellowship, which was additional training over the course of a year.
All right.
To specialize in diabetes management. And I somehow along the journey I had gained some weight, and then I got into nutrition and fitness, and I started to embrace lifestyle change as well for myself. And I realized that a lot of the folks who were coming into my office also had most of them actually had lifestyle issues.
Okay.
You'd like to think that most people came in with infectious stuff where you had to prescribe antibiotics, but that was not the truth. Most people actually had issues surrounding food and lifestyle. And so that's what started my journey into diabetes. One of the interesting things is that, you know, people speak they say how passionate I am about diabetes. But I remember in my interview when I was starting the diabetes fellowship, my boss asked me, he says, you know, are you passionate about diabetes? And I said no. So it's just funny now that people say that I'm so passionate about it.
It's okay, grows on you.
Yeah, but one of the things is that there are just lots of sweet people in the Caribbean.
We are sweet.
Yes, and there's lots of diabetes, and there's lots of gaps in terms of their care. And so my goal is really to help to fill those gaps. You know, I know I can't do everything, and everything won't be perfect. But at least if I get it moving in the right direction and inspire some other young brown convent high school girl to get into diabetes, then I've done well.
Nice. Hi, Elias. How are you? How was your week?
I had a pretty rough one.
I'm sure.
It was probably a 4.5 out of 10.
Wow.
4.5. All right. So, Elias, tell us in terms of she spoke about her journey professionally. Let's hear about your journey health-wise in terms of your diabetes journey, if I can describe it that way.
So it's sort of funny, but the way I would describe it is that diabetes has always been a part of my life.
Okay.
Which doesn't mean that I've always been afflicted with the disease, but it has always been a very significant part of the consciousness of my family. So I say all the time, like I was trained how to live with diabetes because I've experienced a fair amount of it. I have it on both sides of my family, but on my father's side, it is probably a more critical situation. I know to have gotten the disease and died from it would have been my grandmother on my father's side, who died, I think, 3 years before I was born. And since then, a number of people in my family have been afflicted with it, and it was a pretty significant part of like how my parents fed me and how my parents taught me to take care of myself, with the understanding that like this could possibly one day be something that you have to deal with, and you have to prepare, right? You should be ready.
Yeah. And it's crazy that families, you know, you talk about legacies, and health is one of those legacies that parents have to talk to their children about. So, Doc, let's start. For those of us who take it for granted in terms of the knowledge about diabetes, tell us about the types, because he's talking about something that sounds genetic, and I know we have other reasons for them.
Yes.
Yes.
So the two main and most common types of diabetes would be type 1, which typically happens typically under the age of 10.
Okay.
And it's not through anyone's fault. It's not through their diet. It's not through their lifestyle. There is a genetic component to it, meaning that if there's a family history of type 1 diabetes, you could be affected with type 1 diabetes, but also there may also not be any family history.
Okay.
And usually there's a thought that there is some sort of mild infection. It could be a viral infection, and basically what it does is that it shuts down the insulin producing cells in the pancreas. And because the pancreas those cells no longer produce insulin, the only treatment becomes insulin. So because we
Okay.
cannot live without
Without it.
insulin.
Yeah.
Because insulin is sort of the key that unlocks the door that allows the sugar
Yes.
to get into the parts of our body that needs it.
Right.
And
In other words, to diminish the amount of sugar.
well, it makes sure the sugar gets into the right
Places,
place.
okay.
Into our muscles, into our brain, into fatty tissue, and so where it can be used.
Right.
Yeah. So that's what insulin does. And so in type 1 diabetes, it typically affects children, but it could affect adults as well. It could also happen between the ages, under the age of 20 as well. And that's one of the things that are missed. Sometimes when we see adults with diabetes, we think it's all diabetes in adults is type 2 diabetes, but there is type 1 diabetes in adults. The other common type of diabetes, so type 1 diabetes is about 5 to 10% worldwide, only 5 to 10%. And it tends to affect more Caucasian people, but it does happen in people of African descent.
Okay.
But 90% of diabetes is type 2 diabetes, which is related to lifestyle.
Diet.
Which is related to inadequate exercise and excessive caloric intake, meaning excessive food consumption. But there is also a genetic component, meaning that if there's a family history of type 2 diabetes, you are more likely to develop it. And I think part of the reason is that as families, we learn how to eat and how to move, and we learn our lifestyle from our parents.
Right.
And so if you have parents and grandparents that had diabetes, then you likely learned how to move and to live as they did.
So, Elias, I'm assuming that you fall on the type 2.
That's correct.
Yeah. All right. So, Doc, we are approaching the sweetest season of the year.
Yes.
And we already since last week, food, rum, chocolates, we're planning our Christmas dinners already. We're choosing our outfits. We're already preparing our minds to eat a lot. We're going to talk about the prevention first.
Yes.
In terms of people who are not necessarily predisposed. We're talking about the average person who just want to be out there living their best life. We're going to start with what do you want us to know in terms of guarding ourselves? We know that it kind of just happened over a little Christmas, but it can probably be the start.
Yes.
Yes.
So I'd like you to let you know that there is actually no average person.
Okay.
Sorry. Yeah, so there are only two categories of people, and there's only two categories of people in this world. There are folks who have diabetes,
and the folks who don't.
No, and the rest of us are on our way to develop it.
Oh no.
Yes, particularly what you have the people like Elias who are more at risk because there's a family history.
Yes.
But even for folks who don't have a family history, they are at risk because at the end of the day, if we have in the Caribbean, we have a large population of people who have diabetes. And although we may think like because we don't have a family history, we are not affected.
Yeah.
Because we are surrounded by so many people who have diabetes, that means we have a diabetogenic environment.
Yes.
So it puts us it puts us all at risk. And so diabetes is not something that happens or occurs in isolation. Because we both went to convent high school around the same time, maybe
a little. Yes, so just about same era.
Yeah, and so you would have been there at recess time when they sold the sodas.
Yes,
we were both there.
Yes,
and so if we're in the same environment, we consume the
same food.
Then we are likely to develop the same conditions.
And the same applies for families who eat from the same pot.
That's right. And I frequently see spouses who come into my office, and one would have diabetes, and the other one would be like, there were absolutely no concerns. Maybe sometimes they don't have a family history on their side, but the reality is that in most cases, I always tell the spouse that if they don't have diabetes, chances are they're on their way to develop it. And what I've found in a lot of instances is that they are.
Yes.
Not only are they on their way, but some of them have turned out to have diabetes, sometimes years after their spouse develops it.
So, okay, I just want to ask Elias, okay, Doc and Elias, What are the categories in terms of can you be very, very sweet? Is it, do you have levels, or it's just you have it and you have it and
Yeah.
this is it?
Yeah, so so once again, it's kind of either you have diabetes
Or you
or you're
do.
on your way to
Do
or you're
have
on your
it.
way to develop it. So there is a particular cutoff point at which we say that you have diabetes. So that's either
And
if
you can't go back after it's there. It's
no,
it's
there is no
not,
going
it's
back.
irreversible. Okay.
It you may get back to normal blood sugars through diet and lifestyle.
Right.
But I always tell folks that is that you have it. The mere fact that your blood sugar can go up to 200 or 300 means that you have a tendency towards going towards diabetes, and it may show up later in life. It may show up during a stressful situation such as a car accident or a major surgery. It tends to show up during pregnancy because pregnancy is diabetogenic, meaning that it creates diabetes state, or if there is a change in lifestyle, so the person stops exercising and they continue eating or they eat more, then it can show up. So it doesn't go away. It doesn't. Because the blood sugars are normal doesn't mean that you forget about it. You always have to be on your P's and Q's. And so
Yes.
that's why even though Christmas time and the sweet time is coming up, everybody should be cautious.
Yes.
And yes. So
Eliza, I want to talk about what is it like. I mean, when I posted this, I said, growing up, it was an old people thing for me. Pressure, the old people say,
Sugar.
yeah, sugar. But to put the face of diabetes, I mean, eventually, you grow up and you hear that younger people have it, babies have it, children have it. Tell us about what life is like for you in a country where we know that food and drinks and those sorts of things can be tempting and limited in terms of the diabetic life.
So I think a lot of people think of sugar as a temptation. But for diabetics especially, and this is my experience, this is an actual addiction. This is a full blown addiction.
Wow.
There's a little man in my stomach that wants sugar, that feeds on sugar, and all he wants to do every minute of every, I'm not even joking, like every minute of every single day, all he wants is sugar. And if you give him sugar, he forces me to become lethargic and feel like I'm low energy, which
Wow.
then suggests that I need sugar, right? I want sugar all of the time. Whenever it is that I do have, like, okay, if you're, and I've gone through stretches where I've been, eating well, managing my sugars well, like doing a pretty good job, losing weight, all of that stuff. And in those times, he is the most active. Like when you feel like you're actually achieving stasis and actually achieving balance in your diet and in your overall health condition, this is when he is most active.
Yep, I
Right?
can imagine.
And so that's pretty much what we're battling every day. So you can imagine with
So let me just ask,
with
Elias, you have the festivities of Christmas and, holidays coming up, big dinners, those sort of things. What are some of the precautions you have to take? That you have to take half portions, or you just
be
don't
honest,
partake, or
most of it has been taken out of my control. Like I've already started getting warnings, both at work and at my home, about what I can eat and what I cannot eat and what I shouldn't be eating. And like I have people at work who literally like knock something out of my hand. I've had food taken away from me at work, right?
those
From
are good people.
From people who genuinely care about me.
Yes.
But heading into this particular time of the year, it is incredibly difficult because I love fruitcake, and I never want to stop eating
And
fruitcake.
fruitcake is loaded with sugar. Loaded.
I mean, whatever is not sugar in fruitcake is fat.
Yeah.
And so that's really really difficult. But then if I even break it down to like regular life, just walking into a supermarket in our country is particularly difficult, because if you really try and start reading like labels and stuff, which is an active part of my life and how I function, when you read the fact that like in many single in many products that are packed for single use, there are multiple servings
Okay.
in there, right? And even the information that you get at the back with regards to like sugar and like the total carbohydrates, that is relating to one serving. And if you drink the whole box of juice, or you eat the whole the whole thing, you're essentially consuming 2 and 3 times
What you're
what is
supposed to.
recommended as one
Yes.
serving.
Yes.
You know, that's particularly difficult to deal with. And again, as a diabetic, you're always hungry, you always want to eat, you always want sugar. And if you start drinking a big box of juice, you are not going to stop drinking the box of juice. It is never going to happen.
Okay, we're going to take a word from our sponsors one more time. And when we come back, Doc, we have to talk about, he said something which is very important, and I don't think we do that often, reading our food labels. So
Yes.
when we come back, we're going to get some really, like some tips, which is important. And we know those tips, but we need reminding of them. All right, so we will be back in a few. And please leave your questions on the thread, or you can call in to ask Dr. Jolly or Elias any questions in terms of the journey. All right, remember, you are not alone. And if it's one thing, health is wealth. I totally understand that, and I appreciate that, and we should always remind ourselves that. All right, so when we spend money on clothes and shoes and those sorts of things, we also should always spend the same amount on our health. All right, so stay tuned. We will be right back.
Malcolm Stephen and Sons across the bridge is the headquarters, guaranteed for all your frozen meats, poultry, ham, turkey, fish in fridge every day, every week, from Monday morning to Saturday afternoon. Malcolm Stevens is the people's first choice for the ever-fresh quality, with the widest variety and assortment of all your fresh favorite frozen foods from across the Caribbean and across the world. Guaranteed freshness. Pat mouton, pat cabouit, mandi la cabouit. All the frozen chicken parts you could ever need. Legs, breasts, well, yes, breasts, chest, thighs, feet, gizzards. Malcolm Stevens' back and neck is not back and neck, is neck and back. Dominica alone gets the freshest and the best from Malcolm Stevens' Sons. Swinging sassing for their drumsticks there, and first serving it. Your beans, your peas, your salted and pickled meats, tout pat cochon. When you want a broth and a soup, you need to come to Malcolm Stevens and Sons. Nobody makes a better pillow or broth or soup than a Dominican. But the secret is that they buy all their tastiest, nutritious, and satisfying frozen foods only at Malcolm Stevens and Sons in Portersville. Tell them I sent you. 448-8709 or 235-5521.
Pure, crisp refreshment. Caribe Hard Cider. Yours to enjoy. With a delicate, exotic taste you just can't get enough of. Caribe Hard Cider is perfect for any occasion. Crafted with champagne yeast, it's an all-natural, gluten-free blend that'll keep you coming back for more. Caribe Hard Cider. Available in original, pineapple, and rosé.
A Sunday picnic. A family get-together at home. Sarah, Dan, Aunt Mary, even Grandpa and the twins too. Visiting Uncle Jim.
Hey, Uncle Jim, pass the bucket, no man. So hot.
A warm visit to a KFC restaurant. Special moments, anniversaries, graduation, movie and games night, reunions. KFC. Get together.
You looking for good eggs? I mean quality fresh eggs straight from the farm? Well, we have exactly what you're looking for, no matter the quantity. We've got the right amount. Visit us at Prince City downstairs Kyrie FM on Independence Street for your fresh farm eggs, or call telephone 448-7331, 448-7330 or 448-8752 and we'll get you your fresh farm eggs.
I'm not exaggerating. Boiling with excitement.
Ooh, isn't it? Lovely, lovely things indeed. Your small enterprise of choice for personalized cups, mugs, pillows, glasses, tote bags, corsages, and so much more. Weddings and birthday keepsakes. 245-8483. Visit our Facebook and Instagram pages. Lovely things, anything but the ordinary.
All right. right, we are back again thanks to our sponsors. And just before the break, we were talking to Elias about his life and little man in his stomach that really always really not helping him in terms of fighting his sugar cravings, you know. But Doc, this is your time to give us those very, very important tips in terms of.
Oh, really? So I like the fact that Elias brought up, you know, the fact that, you know, how difficult it is in terms of managing the diet. Because because the folks who are in the category of heading towards diabetes, you know, we don't necessarily have to think about what it is we eat. And the thing is that we have to eat. We eat 3 meals a day, breakfast, lunch, and supper.
Others more.
Yes. But here's Mr. Dupy, and he constantly has to think about, you know, the types of foods that he consumes and how much carbohydrates and how much sugars, and he has to read nutrition labels when he goes to the supermarket, which is something that the average person does not do. And they also don't have to think about it. So you know, I think one of the things we have to think about is to really to understand how difficult it is to manage this condition, and to be more compassionate towards people who do have diabetes and who struggle with managing it, because it can be something that is very challenging. But I like the fact that he brought up also that he reads he reads and he has to look at nutrition labels, because that's one of the things that we don't do, and we don't think about doing.
So we should do that. Everybody should just consider reading.
We should at least learn the basics, because if you go to the pharmacy and you get a medication, we read what is on the label.
You ask, does this contain penicillin? Those sorts of things.
Yeah, we ask, you know, what if there are any side effects. We make sure the medication is correct.
Right.
But we don't do the same thing with our food in terms of thinking about what is in our food or what process it goes through before we consume it. Again, this is something we are putting into our bodies.
Yes.
And so I think we have to be more critical about what we put into our bodies in terms of our food consumption.
Doc, we actually have a call.
Oh, sure.
Hi, good morning.
Good morning. How are you doing?
Good morning. How are you, Mr. Bellot?
We have just I just want to give a little tip. When I get sick with cancer, or diagnosed with cancer, I had to go on a special diet.
Okay.
And I make the notes of all the foods the doctors told me I can and cannot eat.
Right.
And then when come for ingredients, I ask them for the main ingredients that I shouldn't eat. So I just give you a little tip. Nobody has time to read a whole label when you walk into a supermarket.
Right.
But all you do, if you tell you sugar, just look for how much sugar in everything. Just look for sugar. Or just look for
carbohydrates.
The carbohydrates. Whatever they told you that's not good for you or too much is not good for you. Just look for that in every label.
Right.
And know that that food, once it's about 3, 4, 5%, is not for you. You understand? Because you always have the percentage of sugar, percentage of carbohydrate. Anything above 5% of anything, you have a problem. It's too much.
All right. Thank you, Mr. Bellot. All right, Doc, what's your take on that?
So in terms of reading the food label, one of the things that I do is that you look at the serving size. And like Mr. Dupy, he did talk about it in terms of many of the packages have more than one serving in there. So, for example, if you're drinking, you have a bottle of juice, you want to see, is it is it the full can, which may be 500 milliliters, or is it half the can? The second thing to go down to, you go to carbohydrates, and below that you will see sugars. And in the sugars, it has the number of sugars per serving in grams. That's another trick. Most people do not know what a gram or a gram of sugar looks like. So on the labels, most of the information in terms of the sugars or salt is in grams. So a quick trick that I use is that 4 grams of sugar is 1 teaspoonful.
Okay.
Because most folks know what a teaspoonful looks like.
Right.
Yeah? So 4 grams of sugar is 1 teaspoonful. So if 1 or 500 mils of that juice has 40 grams of sugar, so 40 divided by 4, that has 10 teaspoonfuls of sugar in it. And so what I think of is like, well, okay, if I made this juice or at home, or this quantity of drink,
how much teaspoons you would have put?
How much sugar would I put in there?
Right.
And so that gives me a visual clue as to what is going on.
I remember seeing this photo of different foods and they had sugar in bags.
Yes.
And I remember seeing Coke.
Yes, and you saw the amount of sugar that
I
is
was
in
like,
there.
whoa.
So those are called what we call sugar sweetened beverages.
Yes.
And they have a lot of added sugar. The other way to tell is if you read the ingredients. Number one, if there are lots of ingredients, that means there's a lot of it's too many. There's just too many different ingredients in there. It's a highly processed food. And if sugar or an ose, meaning a maltose, a lactose, a fructose, a high fructose corn syrup, shows up within the first 3 ingredients, likely there's a lot of it. Because the ingredients are listed in the order of quantity. And frequently you will see that there is water, sugar is next. So some ose, high fructose, maltose, cane sugar, sometimes honey. There's lots of different names for sugar as well. And then they'll have the other ingredients. So that's something to look out for. But I just want to let Mr. Dupi know that, and our general listeners, that actually the best foods out there actually don't have any labels on them.
Exactly. The fruits. But okay, so Doc, what are some, so apart from reading your labels, what are other tips or some foods to avoid or to decrease in your
diet?
In our diets.
So the first things for everybody, the first thing I try to do is also put those green leafy non-starchy vegetables on the plate.
Yes.
When you go to Christmas dinner and you see all the nice, the meats and the turkey and the ham, and you know they're gonna have all the different pies and the rices and the macaroni pie and all of those things. The first thing I want you to look out for are the vegetables.
Salad, yes.
Yes, put the salad on the plate and make sure it covers half of the plate. Yeah, I think
so that's a tip for Christmas dinners. Everybody, listen. Half of your plate should be. Elas, I need to take this.
Yeah, that's a really hard one, but that's the first one. Put the vegetables on the plate.
We have another caller. Hello, good morning.
Hi, good morning.
Good morning.
Yes, very, very, very interesting program, educational as usual. I have 4 questions.
Wow.
Do you have
Go ahead.
Good. First question to the panelists is, I'm going to ask a question and hang up and listen. How does the medication stabilizes the illness? That's one. For instance, we have the virus and the vaccine now. The vaccine stabilizes the virus. How does the medication stabilizes the illness? The second question is, what is the range of your blood sugar? Where does it
What's
fall?
the acceptable rate? Range.
Okay. The third question is, how does vitamin help in stabilizing the illness?
Can you say that again?
I'm saying that you should not take any sugar or sugary foods at all.
The doc is taking your questions, definitely. Thank you very much. We appreciate your contribution.
Okay.
All right, bye-bye. So, Doc, yes?
Yeah, so that's a lot. That's quite a few questions. So one of the misconceptions is that if you have diabetes, you can't eat sugar. So that's one of the misconceptions about diabetes.
You still should.
So you can eat sugar. You should watch for the quantity and for the quality of the sugar. So using less refined sugars, such as brown sugar, I just want to let our
Which is
listeners
better, brown or white?
Brown, because it's less refined.
Okay.
So if you go towards less refined, foods, then that is better
for you. Okay.
Better for you. But so you look at the quantity but also the quality. But the other thing I want to take note is that honey, a lot of people go towards the honey and all the other artificial sweeteners. Those raise the sugar just as much.
Really?
Yes.
Some people say that because the honey is natural.
Yeah, a lot of folks think that, because it's natural, it's good for you, but you still have to be cautious of the quantity. So a lot of folks eat fruits and they say, oh, fruit sugar is good sugar. But it still raises the blood sugar.
Okay.
And that's something you have to be cautious about.
What about the range? What's the acceptable range?
So I would like Mr. Dupe to get involved here. But normal blood sugar in the morning is between 80 to 100. So I usually tell folks about 100. If you want to think of a number, fasting, meaning empty stomach blood sugar, should be about 100.
Elias, may I ask, what is your normal? What is your rate actually?
For me, anywhere between 110 to 130.
Okay.
130 on a what type of day?
That's a good day.
That's
for
a
me.
good day. Okay.
That's a good day.
Yes.
Okay.
So yeah.
If I get to like 150, 170, I have a problem today because I can't eat for a while, and I have to figure out how do I stabilize that. Because I think what Doc was saying when she said, people typically people don't have to worry about their sugar intake, is that your body is entirely regulating all of that stuff for you.
Yes.
Right. All of a sudden now you're in a position where, or if you have diabetes, you're in a position where you have to start regulating that for yourself.
Mm-hmm.
So. Like I love, and I'll shout them out because they're one of your sponsors. Like I love Caribe, but I have to earn a Caribe if I'm gonna have it.
Yes.
I gotta make sure my blood sugar is like within range of like what is low for me.
Yes.
So that it won't completely like push me over the edge.
Yes.
And obviously, I have to manage like how many of them I have. I can't sit and have like 6, like somebody else might. But it doesn't mean that I can't have one at all.
Mm-hmm.
Let me just ask you one question, Elias. Does your family, the people around you, eat to support you? Meaning, we let us eat what he's supposed to eat to not make him feel, bad.
Yeah, that's part of the support.
So for the record, I want to call out Lily Walsh UP as an absolute terrorist. He took over my diet from day one. Like I got diagnosed in the morning. I had a doctor's visit in the morning. My blood sugar was 3 something.
Mm-hmm.
She sent me. The doctor sent me to. She told me, okay, go eat. Before you eat, go like get a test from the lab, right? That test came back as 721, which is insane. Doc said it's supposed to be 80 to 100, right? Mine was at 721. To be fair, I just eaten, but it's not supposed to even be anywhere close to that. It was 712. Sorry, 712. So from there, it's like hospital and all of that stuff. I'm literally talking about between 10 o'clock in the morning and 3 o'clock in the afternoon, my entire diet changed. She cleaned out everything from her kitchen that would have affected me. That day, I had salad only, and
as you
pretty
should.
Much
I appreciate that.
Pretty much, I ate grass.
I appreciate that because I am certain, Doc, this is one of the important things that families have to rally around their person.
They do, but I would be cautious about that because actually they have to do it too.
Yes,
which is really hard to do as well.
Someone asked, Doc, at what level are you considered pre-diabetic?
So pre-diabetes, the easiest test is the hemoglobin A1C because it actually tells you whether you fall in diabetes or pre-diabetes, and I find it a matter of fact, it diagnoses diabetes earlier. So diabetes is an A1C more than 6.5.
Okay.
If you're more than 6.5, you have diabetes.
Okay.
Yes. Pre-diabetes from 5.9 to 6.4.
All right.
Yes.
For the record, after the first 3 months, my HbA1c was 4.9.
Oh, okay. So that's pretty good.
And Elias, someone asked, are there times when you get very sick that you're unable to function? If yes, what triggered it?
Not so much very sick, but just kind of lethargic. There are days when I come home and I don't want to do the extra work that I know I need to do at home. That can kind of set you back, sometimes a day or two on a project. There are times when, like I had a day last week Saturday, I think, where I didn't feel like getting out of bed. I just didn't. And I stayed in bed all day. I didn't really eat much. I just sort of watched movies for most of the day. You can have a day like that every now and then.
And I'm assuming that if it's very bad in different people, it can send you into shock or those sorts of things.
Absolutely.
Yes, yeah.
Extremes of blood sugar can have you end up being hospitalized.
Wow.
There is, for example, if your blood sugar is very high, like sometimes I check folks' blood sugar at my office and the machine just says high, meaning that it's out of the range of the meter.
Wow.
So if you have blood sugars, 700, 800, 1,000, you could go into a condition called diabetic ketoacidosis, which could potentially be a life-threatening condition, and usually requires hospitalization and insulin to sort of take care of that. But also low blood sugar is also
bad.
Yes.
We're going to take a call and then we'll get on to wrapping up with our tips because we have our season is here. Hello, good morning.
Hi.
Good morning.
How are you?
Fine, thank you.
Okay, I almost missed the program. I didn't want to miss it.
Happy you're here.
Right. No, I was diagnosed with gestation diabetes when I had my both children.
Okay.
And then I ended up just losing weight one time and just going to the doctor and then going to do my test and he realized that it wasn't gestation diabetes anymore. As to what type I have, I don't know.
Okay.
Because I am on medication. I take glyburide and 2 glyburide in the morning, 1 metformin in the afternoon, 1 glyburide in the night.
Okay.
A lot of these things. I am a vegetable person. I don't like. I use a lot of. I use only brown sugar. So a lot of these things Dr. Jolly saying is not that I don't know how to do it, and because I am that type of person that I am a vegetable person. I try to get my children to probably eat. Just like you would know that food at home wouldn't be good if there is no vegetables.
Right.
I don't take in sugar. I don't like ice cream. I don't like chocolate. I don't like cake. The only cake I would eat is fruit cake, and the only ice cream I would eat is coconut. So I'm not a lover of those things. So I know even if I see a chocolate there, and if I take one little piece, I wouldn't take more than that. I would just like to know at what time you get like that. I know I have that diabetic nerve under my feet. I sometimes get up in the morning and it's not pricking, but it is not numb, but I have that feeling that I cannot really step and walk as I want until after a certain time. So I would probably like Dr. Johnny to give me a little advice. What can be done for that? I know diabetic nerve after a certain time, you feel, every time you knock your body, you feel that, it's like a pain. I know what, usually causes that. But what I would like to know, if there is any medication you can use for under your feet, because that is really the problem for me. That is very under your feet, or if there is something you can take, whatever you can take to probably remedy the situation.
All right. Thank you very much. Take care.
It's a very interesting program. The little that I grasp so.
Thank you.
Okay.
All right. Bye-bye. Yes, Doc. And unfortunately, we have 5 minutes, so we have to get some info in. Yes.
Yeah, so one of the main reasons we address diabetes, we treat diabetes, is to prevent the complications of diabetes. Not because we like nice numbers and we like nice blood sugars between 100 to 180.
Right.
But really because these complications in terms of the eye complications, the kidney complications, and the feet complications in terms of the neuropathy, they affect your quality of life.
Yes.
And they can affect your life because you could end up with amputations and end up on dialysis and these sort of things.
Doc, may I ask quickly, in terms of like the alcohol consumption, I was reading through some some of our levels in the Caribbean in terms of alcohol consumption and diabetes and so forth. What is your advice for people who are going to partake in alcohol for the festive season? that if you're diabetic, do you take none at all, or is there something you prefer? You know, like there's some people that say there are sweet wines and there are unsweetened wines, those sorts of things. Can you advise?
So again, you watch your alcohol consumption, because
Right.
alcohol is not a nutritious substance.
It's not.
It's think about it. It's not a nutritious substance. It's not. It doesn't add any vitamins or minerals to your body, and so it's something that
Just
we do.
recreational.
That's correct. And so, but it has calories, and particularly things like the whiskey and the vodka. All of these have calories
Right.
that add to our body fat,
Yes.
and that could lead to insulin resistance.
But if you have to advise, which is the
The
better,
best advice. So
the better alcohol, if that's something.
I don't think that there's. I don't think that
But
there's.
if someone is, you
Mhm.
know, they are a social drinker and, you know, they'll take one or two of those sorts of things, what would you advise to stay away? I have heard that to stay away from the red alcohol. Yeah.
So I don't think that there is a good one for people who
Okay.
have diabetes. I think you just really have to watch your alcohol
much?
consumption.
Yes.
We as doctors, we're just aware that our patients are going to drink, and so you have to watch the alcohol, because in general it's not great for the diabetes, but also if you're taking insulin in particular, it can cause low blood sugar.
Yes.
So that's something to watch out for. So it's okay to have one drink or two,
Mhm.
but certainly you don't want to be drinking from Thursday all the way down to Sunday.
We don't.
Um,
Elias, may I ask if you have to, well, I'm not sure what do you drink, but if you drink a wine or so, do you have a preference?
I like whiskey,
Okay.
and for me, it's only one,
Okay.
and you sip it slowly. You take your time.
Yeah, so you enjoy it.
Okay.
You enjoy
rather
it.
than just shots after shots.
Yes, yes.
Okay. And of course, I'm
Now,
sure you would, yes?
No, sorry, go ahead.
And I'm sure, Doc, you would advise checkups. Health
Absolutely.
checkups.
If you have diabetes, you need regular checkups. So just to answer the last caller's question in terms of the nerve, the
Yes.
nerve issue, the first thing actually is to check on the diabetes. That's the ground and the foundation, and that's why we developed the diabetes complications. You got to get the diabetes. The diabetes has to be under exquisite control.
Yes.
But I just want to note that her learning point is that she had gestational diabetes, and then
Yes.
she developed diabetes after the pregnancies, which means that again, gestational diabetes is diabetes during pregnancy.
Does it go away after pregnancy?
It may or may not.
May or
depending,
may not.
It may
Oh,
or may
wow.
not.
Okay.
For some people, it's just caught during pregnancy, but they
Ah.
had it before. For some
Okay.
people, it shows up during pregnancy. Or I've had folks who developed, it was actually type 1 diabetes that showed up during pregnancy.
Okay. Wow.
And so it could be anything.
Yes.
But in terms of the nerve issue, it's really taking care of the diabetes, but there are prescription and over-the-counter medications that can help with the nerve pain. But once again, the foundation is always to make sure that the blood sugars are well taken care of.
Thank you. This, as usual, our guests are always amazing, and they came through. I want to say thank you, Elias, for sharing, giving us a little window into your life. And we hope that all diabetics have a wife like yours who will make sure that you are well taken care of, you know. And Dr. Jolly, thank you so much for the passion that you thought you didn't have in the beginning, but here you are, really doing what you can for Dominica. I mean, your family.
My pleasure.
Your family has been helping Dominica in terms of in health wise, and you are pioneering in your own little space. So even if you think you're just
pleasure.
one person, you coming on today has shed a light for those who probably were not paying attention. I want to say thank you, because I'm taking away some of the tips that you gave. So everybody, our listeners, on our Facebook page and of course on our radio, we want to say thank you for joining us this Saturday. We will hopefully see you next Saturday with another conversation that will definitely elevate and educate us. All right, so stay safe, everybody, and have a very blessed weekend.